With athletic training, we see a lot of patients that are student athletes here at South Dakota State University. We see them for an array of injuries or illnesses or issues. That includes muscle strains, ligament sprains, sickness, any illness issues that they might have. Most of the injuries that we see are, ankle sprains, knee sprains, hip. We have a lot of labrum tears. We have, hip strains of that nature too. With any student athlete that we know is going to go to surgery, we'll have them do a lot of what's called prehab. They'll do a lot of muscle strengthening, a lot of stretching, any range of motion type deficits that they might have before they go to surgery. The more strength and range of motion that we have before the injury, when we do a typical surgery, we'll have a lot of immobilization period. So they'll be in a cast or a brace or a splint that they have to wear for a certain period of time to protect the healing tissue for a surgery. And the more range of motion and flexibility and strength that they have for that joint or issue that they have before they go to surgery, that will actually help them recover a lot faster. Basically, first day after surgery, we're restricted on what we can do based on the physician's protocol or the surgeon's protocol. We work first off to start off and get as much range of motion as we can. We typically recommend to our student athletes that you come in when you're having an issue for athletic training. For as far as physical therapists or any other healthcare provider, we recommend that if you're having an issue to go in and see a recognized healthcare provider to take care of your injuries. I think the best way to prevent an injury from happening is to make sure that the student athlete or general patient is strong enough and ready from a physical well-being standpoint to start that activity. You wouldn't jump in and run a marathon right away without training, and having a good base built up in strength and range of motion and having that ability to work up to the point where the activity that they're doing is important, that we structure it and build up a little bit and don't just jump 2 feet into the pool.